We get most of our referrals from the Falls Clinic here at the Repat. In line with falls and balance evidence, we have both balance aspects which we try and make predominantly standing rather than seated exercises, and strength and reconditioning elements to the circuit. We have up to 8 patients at one time with 1 physio and 1 exercise physiologist and sometimes an assistant, and they come in twice a week for a period of 4 to 6 weeks and do 90 minutes of circuit, and then we do that in conjunction with an education program as well around falls prevention.
With the exercises, well, they explain to you what is most beneficial for your problem.
Exercise and rehabilitation for me personally contributes to controlling my type 2 diabetes and hopefully strengthening my muscles so that I don't have falls and trip over things.
It's helped me with my balance and helped me going up and down steps.
We run a daily circuit class for our inpatient stroke patients, so they would usually receive a 1-to-1 physio treatment session, and if they're suitable then we would give them an extra dosage of therapy in our circuit program each day as well. We would run our circuit sessions from Monday to Friday, and we aim for about an hour and a half per session, depending on how much the patients can tolerate. Generally we would have anywhere from sort of 4 to 6 patients per circuit class. We try and have 1 therapist and an assistant helping out.
Well, without exercise and rehabilitation, I'd probably be still laying in a bed, not being able to move my legs. I think the more you can work the brain to tell it how to walk again and reinvent what you can take for granted, I think it's most important.
We would try and make our therapy as task-specific as we possibly can, so giving lots of opportunities, working on walking practice, balance-type tasks, upper limb tasks, and even just practicing transfers, getting from lying to sitting, sitting to standing.
When you think about the use of video games for rehabilitation, in a standard rehabilitation setting, you have patients doing very repetitive, boring rehabilitation tasks, like picking up a sandbag from one side of a table and moving it to the other side 100 times in a session, and that's just really boring. But it's the best thing that you can often do for patients to try and regain some function. Think about Fruit Ninja on the iPad. There you're swiping across an iPad surface multiple times, chopping bits of fruit in half, and it's really fun. That maps almost perfectly onto what you need to do in upper limb rehabilitation following stroke.
Human Balance uses a computer screen with a balance board. The patient stands on the balance board. They can do exercises to test the limits of their stability, or also some games. The Wii comes with a balance board. There are some good games to use with patients.
The first one I was on in a bubble going down a river, and you had to move your weight. The best part about it with the games is you're not physically and mentally thinking about your knee.
We use the dance mat in circuit for patients to practice stepping, and also as an assessment tool for stepping strategies. In the Connect system, there isn't a balance board. The patient uses their body to direct the games and to interact with what's happening on the screen. Usually in circuit we have between 5 and 6 patients. It lasts about 1 to 1.5 hours, and we tend to change the games every 10 to 15 minutes.
Circuit's great because it's fun, it's in a peer-supported environment, and you get a lot of practice.
I think the more rehabilitation you can get, the quicker you'll get over their injury.